Hello, and welcome to the third of 4 webcasts about traumatic brain injury and challenging behavior. This webcast focuses on using functional behavioral assessment to understand challenging behavior after TBI. These webcasts are sponsored by the Wisconsin Department of Public Instruction. My name is Julie McGivern, and I teach at the University of Wisconsin-Madison. Before you continue watching, you might want to first view the first 2 webcasts in this series. The content we'll talk about today builds on those webcasts. Secondly, you might also want to download the document listed here, TBI Functional Behavioral Assessment. That document might be something you want to take notes on if you're thinking about a particular student as you watch. And third, all the names of students who are used as examples today have been changed and any identifiable situations altered to protect student confidentiality. If you would like additional information about TBI, please refer to the resources listed here. They're available on the DPI website. The goal of this webcast is to help the viewer analyze and understand the challenging behavior we see in students after TBI. And the tool that we're going to use is functional behavioral assessment. I'd like to begin by examining 3 assumptions that we make when we think about changing behavior. First of all, human behavior is functional. We know that it's meaningful. It doesn't just happen at random. Secondly, human behavior is predictable. Sometimes it's difficult to predict behavior after TBI with students, but we can often anticipate what students will do. And third, human behavior is changeable. It's not always easy, but we can change human behavior. Let's look now at the definition of functional behavioral assessment. FBA is a method of gathering information about situational events that predict and maintain problem behavior. So we're looking at the factors that make it more likely that behavior will occur. A couple things to think about when we talk about FBA. First of all, FBA is a continuous process. It doesn't just happen once. And the purpose is for us to look at what is the function of the behavior and what are the different variables that influence the likelihood that that behavior will actually occur. The components of an effective behavioral intervention plan also are often developed from the information that we get through an FBA. On this slide is a graphic identifying the 6 steps that we'll be talking about regarding FBA. Remember that this process is a cycle and that we may sometimes have to work back through some of the steps in order to be sure that we're coming up with our best understanding of a student's behavior. Let's look at an example here of challenging behavior, and we're going to talk about Joe. Joe is a 6th grade student, and he's returning to school. He's been injured in a bike accident, and it's now 4 weeks later. Joe was unconscious for 12 hours, and he's in what we would call the early stage of recovery. If these concepts of length of unconsciousness and stage of recovery are unfamiliar to you, you might want to look back at webcasts 1 and 2 where these are talked about in greater detail. We can say, though, that Joe's injury was a very serious injury. And now, every day in the lunch line, Joe shoves the students who are in front of him or behind him, and a supervisor stands near him, reminds him not to push, but he does that anyway. So our first step in functional behavioral assessment is to identify the problem. So we want to state the problem clearly. What is the student doing? So for Joe, we're going to say Joe shoves the student in front of or behind him. And this is a description of the behavior that we could all understand and see. We don't want to say things like Joe is impatient or Joe is frustrated. Those things might underlie his behavior, but they don't actually describe what he's doing. So now that we have identified the behavior that we're interested in, we're going to measure the behavior. And this is something that we're doing more and more in education today. So why is it important to measure the behavior? Well, there are several reasons. First of all, we want to look at the severity, the frequency, and the intensity of the behavior. When we do this, we're actually trying to decide whether we're going to intervene. If we have a problem that's really a very low frequency and low intensity problem, we may actually decide it isn't worth developing a complicated intervention plan. We also want to try to identify any patterns in the behavior that we see. Does this behavior only happen on Mondays or only on Fridays? And then finally, we want to have a baseline so that we can tell whether the behavior is getting better or getting worse. So in Joe's case, his behavior happens every day. It's brief but intensive. So we have to think, are we going to intervene? Yes, this is an important behavior to intervene with. So now that we've identified Joe's behavior, we've measured it, we've decided that we're going to intervene, now we want to look at what we call triggers of the behavior. And we're going to start with slow triggers. Slow triggers are sometimes called setting events. And these are factors that set the stage for the behavior to occur. They sort of pave the way for the behavior. And we have two types of these. We have internal and external slow triggers. So let's look at the internal slow triggers first. We can think of 4 categories of internal slow triggers that might affect a student after TBI. First of all, we have the physiological triggers like fatigue and pain that students experience after TBI. Second, we have the cognitive state. There might be confusion, there might be slow processing, there might be inattention. We can also have emotional states that can trigger or set the stage for challenging behavior, like depression or frustration. And then finally, we can have misperception of events or tasks, and that can also set the stage for behavior. We can also think about external slow triggers that might influence the occurrence of behavior. And we can think of people and tasks and settings, all as external factors that might influence whether a behavior is going to occur. So let's take a look at some of the triggers that might be operating in Joe's case. What might these be that set the stage for Joe's behavior in the cafeteria? Well, internal triggers, we talked about these in webcast 1, so just quickly we can think of, is there pain or fatigue? Is there confusion, frustration? Is there lack of understanding of what's happening? And external triggers, now, might there be too much noise in the cafeteria? Or might there be a supervisor who's using a negative attitude? Might there be a particular student in front of Joe or behind Joe that's causing a problem? So these are the things we try to identify as we think about slow triggers with Joe. Now we're going to look at fast triggers. Fast triggers are the events and stimuli that immediately precede the behavior, and they strongly influence whether it's going to occur. So let's think about what might be some fast triggers that affect Joe's behavior. Does the line slow down? Does the boy in front of him turn around? Does the boy behind Joe shove Joe? Does the supervisor say something to Joe that makes him more frustrated and leads to the challenging behavior? Any one of these could be a fast trigger, and we're going to have to study these to figure out what are the things that actually are influencing Joe's behavior. So now we want to think about how we use the information that we've learned about triggers to prevent challenging behavior from occurring. So first of all, if we think about Joe's internal slow triggers, we can think about fatigue. Maybe we give him more breaks. Maybe he's confused and we use a graphic organizer for him. In looking at external slow triggers, now maybe we're going to reduce the noise in the cafeteria by putting earplugs in Joe's ears. Maybe we're going to allow him to eat in a different place. We encourage the supervisor to use a more positive style. Or maybe we put Joe behind or in front of a different student. Now I just want to make a note about these different types of interventions. We might choose different interventions for Joe's behavior depending on his stage of recovery. Early in recovery, maybe we're going to want Joe to just eat in a quiet place so that we can prevent this behavior entirely. Later, we might want to provide supports for Joe so that he can learn to stay in the cafeteria. So we're going to have to think about that concept of stage of intervention. Stage of recovery. So let's look now at Joe's fast triggers. So now he's in the line and the line slows down. So maybe we want to put Joe in front. Maybe we take him out of the line. Maybe the boy in front says, Joe, don't shove. And so we help the boy understand Joe's TBI. Maybe we help the supervisor adopt a more positive style and attitude. These are all sort of our guesses or our best hypotheses about what are the fast triggers that might be influencing Joe's behavior. We're going to need to try out these ideas to actually see if they work, if they prevent the behavior. And it's likely that we're going to find that some combination of these influences Joe's behavior. There may be more than one factor at work here. So we're going to test them out and see which ones really lead to a change in behavior once we address them. So now we're going to move on to the next step in our sequence here, and I look at identifying consequences of behavior. This is step 4 of our functional behavior assessment process. And when we're talking about consequences, we're talking about what happens after the behavior that influences whether it will occur again. And we have 2 types of consequences that we're going to talk about today. One is reinforcement. Reinforcement increases the likelihood that the behavior will occur again. So when we think about reinforcement now, we even have 2 types of reinforcement. We have positive reinforcement, where the student actually gains a desirable consequence. And then we have negative reinforcement, where a student avoids an undesirable or unwanted consequence. So a very simple example of this would be if a student studies hard for a test and gets an A, that might be reinforcement, positive reinforcement for that student. The student has gotten something that that student is interested in. An example of negative reinforcement might be that a teacher says to a class, anyone who has their homework done every day in a week doesn't have to take a test on Friday. So the students are avoiding something that is something that they want to avoid, a test on Friday. So the important thing to remember about reinforcement is that it increases the likelihood that the behavior will occur again. In contrast, punishment is intended to reduce the occurrence of behavior. Now, an important note about this, whether a consequence is actually reinforcement or punishment depends on what happens to the behavior, not on what we want to have happen. So if something increases the occurrence of a behavior, that's reinforcement. If it decreases the occurrence of a behavior, we can think of that as punishment. So let's look now at Joe and what the consequences might be that are operating when Joe shoves in the cafeteria. Well, let's think about reinforcement. It increases the likelihood that Joe will shove again. And so things that might be operating here are he gets his food quickly when he gets taken out of the line. That might increase the likelihood that he will shove again. He also may be avoiding some things that he doesn't want, like he might be able to get out of the line, get away from a supervisor, and that's negative reinforcement working in this example. The bottom line here, though, is that Joe's behavior is actually working for him. It's helping him get what he wants, and that's something that we're going to have to be thinking about as we start to plan interventions. Now, I just want to mention punishment briefly. Punishment is intended to decrease the likelihood that a behavior will occur again. But remember that punishment doesn't teach what the student is supposed to be doing. So let's say the supervisor tells Joe he has got to apologize for shoving the students in front of him or behind him. Well, there's nothing wrong with apologizing, but it doesn't teach Joe what he is supposed to be doing. So we always want to remember to have that positive component in our intervention plans. Our focus today is on functional behavioral assessment. But in webcast number 4, we're going to go into more detail about the difficulty implementing consequence-based interventions with students after TBI. We're going to just talk a little bit about the memory functions, the executive functions, the sensory limitations that might influence whether we can use a consequence-based intervention. We're also going to talk more about the influence of the student's stage of recovery on interventions. And then we'll talk about the problems that we can encounter when we use punishment. But for now, we're going to move on to our 5th stage in functional behavioral assessment, which is to identify the function of the behavior. We talked earlier about the fact that behavior is meaningful, and now we want to pose a question for ourselves. What purpose or meaning does this behavior have for the student? We want to remember that one behavior can signal multiple functions, and then we also want to remember that the function itself isn't the problem. It's not what the student is trying to gain that's often the problem, but how the student is going about that. So our goal is to try to help the student meet that function in a different way. Research on functions of behavior has identified a number of functions that we can often see in various types of behavior. So first of all, escape or avoidance is a very common function. People might want to escape environments or tasks or people in their environment. Another function is acceptance. People want to belong. A third function is access to things that a student finds rewarding. Some students also will use behavior in order to exert power or control. Some will want to exact revenge. And then the last two, getting attention and communicating through behavior, aren't necessarily even conscious to an individual, but they can be very strong functions that influence the behavior that we see. Now, I want to just note that function isn't always obvious to us as we observe a behavior. So sometimes we have to really think hard to identify which of these functions might be served by a specific behavior that we're looking at. So let's look at the functions that might be served by Joe's behavior of shoving in the lunch line. First of all, I just want to comment that this behavior might signal to us that Joe is very impulsive and that the control of that behavior might be beyond his ability right now. This is very common early in recovery after TBI. And while this isn't specifically a function of the behavior, it is sort of a signal to us that we're going to want to pay attention to as we try to look at functions that students are using behavior to accomplish. So Joe might also be communicating to us through his behavior that he's frustrated. He might communicate some sensory sensitivity. He might show his desire to access a reward, which in this case is his lunch. He might also want to escape a situation like the lunch line or a supervisor. He might also want to gain attention or some help from a supervisor or another student. It can also be any combination of the above or all of the above functions that a behavior serves. So we want to remember that the purpose of our trying to identify functions of challenging behavior is to help the student meet their needs in a more acceptable way. So once we've thought about the functions that a behavior might serve, we're now going to develop a hypothesis statement. And this is a statement that sort of summarizes the factors that we have identified that we think influence the behavior. So here's a fairly complex hypothesis statement. When Joe is hungry and tired, and the cafeteria is noisy, and the supervisor warns Joe, he shoves students in line to express his frustration, to get his lunch, and to escape the supervisor and the noise. We think these are the things that influence his behavior. We've looked at the slow triggers. We can see that when he's hungry and tired, that's a factor. We've looked at the fast triggers, the supervisor warning Joe. We've also looked at consequences and functions, and we've identified them to help us understand Joe's behavior. So now let's talk a little bit about how we can help Joe meet his needs or the function of his behavior in a more acceptable way. So we've identified three functions that Joe's behavior serves in this example. He wants to access lunch, get away from the cafeteria and the supervisor, and also communicate his frustration. So let's look at access lunch. We're going to think about how to help Joe meet this need based on his stage of recovery, because what we do might differ depending on how far we are out from Joe's injury. Very early in Joe's injury, we might let him access lunch by giving him lunch, maybe even in a quiet place. That also addresses function number 2. And we're not even going to put him in this complex and difficult environment for him. Later, however, we might want to try to reduce the slow and fast triggers so that we can lead to more success while he's in the cafeteria. So now we're going to help him learn how to stand in line, and we're going to help him learn how to manage the noise in the cafeteria. So just to move on to our last function here, communication, I want to just mention that in webcast number 4, we're going to talk about teaching positive communication sequences. So we'll talk more specifically about that function in webcast number 4. I'd like to end this webcast with 4 principles of good functional behavioral assessment. First of all, FBA is contextualized. It happens in the environment where the behavior occurs. Secondly, it's collaborative. We want to have all the team members put their heads together and think about what are the factors that are influencing the challenging behavior that we're seeing. Third, the behaviors are, functional behavioral assessment is hypothesis-driven. So we're trying to put together our best guesses and then test them out as hypotheses to see which of our ideas actually influence the behavior. And then lastly, functional behavioral assessment needs to be ongoing. We need to continue to look at the factors that elicit and maintain behavior so that we can note if behaviors are changing. We have one more webcast in this series, and that is webcast number 4, Planning Interventions for Challenging Behavior After TBI. In this webcast, we'll talk about designing effective interventions, and we'll talk about teaching positive communication sequences to students who are using challenging behavior to communicate their needs. If you have questions or comments, please address them to the contact on this slide. And thank you again for your time and attention today.